Yes,
Yes.
we're hearing that in the chat. So, Kylie, some great feedback in the chat so far that, if people are here because I think it's important to monitor the pulse of the community and how we can serve them better. There's a general interest in public health, and we have a response volunteer advocate and nurse educator who wants to hear what's going on. So, without further ado, I'll turn it over to you.
Thank you, and please let me know in the chat if you cannot hear me well or need to pause. Ren will monitor that the whole time, so we are happy to take questions throughout the presentation. As an introduction, my name is Kylie Lattimore. I work with Ovation Healthcare, managing all of their community health needs assessments. So I worked with North Country Healthcare and Coas County Family Health on the CHNA here in 2025 and also back in 2022. So today we're going to be reviewing the findings of the assessment from 2025 that we
of the community health needs assessment that was recently conducted. To go through the purpose of a community health needs assessment, for those who aren't familiar, a community health needs assessment is a broad overview of community and population health for a specific community. So we're going to outline what community we're defining during this assessment. But a CHNA is required for not-for-profit hospitals to complete every 3 years. But there's other organizations required to do it, like FQHCs, public health departments, etc. But community health needs assessments are really useful outside of just, being requirements. They help us understand community perception and gather community feedback, identify service delivery gaps or areas of opportunity that our healthcare organizations and community organizations can take, and then also are a great resource for collaboration among community organizations. So you'll see that throughout the North Country Healthcare facilities and Coas County Family Health Services doing this together. The steps that we took in this assessment started with a community survey. So those of you on the call today might have completed the survey back when it was live. We'll review some of those findings today, but that's really important as we start this process to gather that qualitative community feedback and get the perceptions of the community, especially as we move into that second piece of this assessment, which is data analysis. We look at population health metrics, usually at the county level, to determine some of the top health priorities, but understanding there's always some data limitations when we look at lagging in data from past years, as well as we think about more rural communities and access to different data points. So you'll see throughout this presentation, we do combine the community responses to the survey, as well as that secondary data analysis to really inform this assessment. So from both of these items, we determine the top health and social needs in the community. So we'll go through kind of high level today what that looks like, what the organizations in this assessment identified as those top health needs identified in the community through the assessment, and what resources are available to address those needs through implementation planning. So really that's an ongoing effort that the team works on as we focus on the future, identifying these top health priorities and what our goals and objectives are in the future to address these. So starting with community demographics, the definition that we use for this assessment of our service area is the North Country region. You can see highlighted here in blue. We know a lot of data that we have available isn't always in this regional assessment. So we do, in some areas, pull together some data from the county-based service area, Grafton County and Coas County where possible. And you can see throughout the region, all of the North Country Healthcare and Coas County Family Health Services facilities are located throughout. The demographics of the community for the North Country region, we're looking at a population just shy of 52,000 people. Some highlights in terms of this breakdown, we can see that there is a large 65 and up population. So 26% of the North Country region residents are 65 and up. And this is, we can tell, very high compared to the state average at about 20%, 65 and up. So aging population, which is specifically important as we think about healthcare, public health, the people who are accessing and utilizing healthcare services. And this is reflected as well through our median age, 53 in the North Country region compared to 43 in New Hampshire. So additionally, not only are high utilizers of healthcare services, but also our workforce in the economy. And then our median household income, 52,000 in the North Country region, lower than the New Hampshire average. That's about 83,000. So a few things sticking out here that we'll continue to discuss, specifically our senior population and our low-income groups in the community. Our race and ethnicity breakdown, you can see 92% majority of our community being white, with about 6% being other multiracial and 3% Hispanic in the population. Now jumping into our community survey, we gathered 1,164 survey responses from a range of different groups in the community. You can see highlighted in the map on the right, the zip code-based areas that respondents came from. So of course, majority of our respondents coming from the North Country region, but getting some respondents as well from across the border in Vermont and throughout the state. Majority of our respondents were white and also 65 and up. So about 40% of our respondents being 65 up. So keep that in mind as we're thinking about some of the feedback in the data, but then an additional 60%, the remaining population being under 65 as we compare. This is pretty normal when we do these assessments as we think about survey gathering and the people who use surveys or the people who interact with the healthcare system who might run into the opportunity to take the survey. So seeing that 65 and up kind of as a greater percent isn't totally uncommon, but something to think about as we look at the results. And then our household income kind of distributed across these different areas, with the majority, about 30%, being 50 to 100,000. As I mentioned before, looking at some priority populations in the community, this is particularly interesting to look at both through the data as well as the community perception of populations in need. So these might be populations in the community who have barriers to care, hard time accessing healthcare, or need additional resources when it comes to accessing services. So you can see 64% of respondents identified older adults as a priority population, followed by low-income groups by 62%. So we saw that in the data as well. We know we have a large 65 and up population here in the North Country region, and then we also know our household income is significantly lower than the state as well. So, you know, a good pulse between both our community respondents as well as what we see in the data on some of these certain populations that we might want to target as we're thinking about health interventions or resources. So we also asked for some feedback on some specific health challenges or what populations might need in the North Country region, with a lot of key themes being around, you know, access to transportation, reducing barriers through access to telehealth services, mobile health clinics, health literacy, access to providers, both medical and dental care across the region. So you'll see this throughout, but wanted to make sure we encompass some comments and some qualitative feedback that we got from the community members on what some specific challenges are. Now getting into the ranking the health needs of the community. In the survey, we asked respondents to rank the different health community factors on a scale of 1 to 5, with 1 being not important to address in the community and 5 being extremely important to address in our community. So you'll see we're first looking at health factors, so some traditional needs, mental health, cancer, and heart disease. On the right side is a weighted average out of 5, so the closer to 5, the more insignificant that the health priority was rated. Then you can see the breakdown between, I would say, both. So that dark green on the right is the percent of people who voted 5 for each of these health needs, followed by the blue, which is 4, and then the light green, which is 3. So we can see mental health, nearly 75% of our respondents said mental health was a significant challenge in the community, followed by cancer at 69%. So both reflected in this weighted average, as well as who's rating it as significant needs. So again, seeing those top challenges here: mental health, cancer, heart disease. We also asked about different community factors, so things that might be social determinants of health, things in the community that influence people's health outcomes or ability to access healthcare. Again, you can see the weighted average out of 5 on the right, and then the health need on the left. So affordability of healthcare ranking towards the top here, as well as affordable housing. So 70% of respondents rated this a 5 in terms of importance in addressing in the community. So we would say here, you know, a lot of these assessments that we're doing, affordability is a huge issue across the board, whether that be healthcare, housing, food. It's definitely something that is continuing to increase in terms of prioritization, and something that's important as we think about our healthcare organizations or public health entities, and what we can kind of do to reduce some of these barriers. Lastly, looking at behavioral factors, you'll see we broke out some of these between adult and youth needs, with the top being adult drug and substance use, followed by youth drug and substance use, which rated both fairly similar, I would say, in equal measure, at about 60% getting 5s in terms of importance of addressing, though a little lower than we saw on some of our traditional health factors and our community factors. So the last view I'll share here is the same data you just looked at, but combined. So we pulled together the health factors, community factors, behavioral factors overall into a list. You can see the top 15 priorities here on the left from our 2025 survey. In the middle, you can see the results from our 2022 survey. And then on the right, you can see the top 15 health priorities. A significant increase in the outreach and participation from our community members compared to the 2020 survey, but still interesting to see how the priorities align between different years, with the indicators on the left only showing the change in rank order. So you'll see the weighted average is not going to be perfectly comparable, considering the N value is different, but we can see some shifts in priority. I would say the kind of one point as we look up at this region of note is just the drug and substance abuse. Still a significant need we see in the top 10, but maybe just outside of the top 5. Though we see it ranking higher more nationally. So as we think about behavioral health challenges, why that might be, or the importance of some of these more maybe chronic diseases or health issues that we saw identified in the community. Okay, so now looking at some population health data, we're going to walk through the secondary data analysis done in this assessment, and we'll combine it with some of the community input from the survey as well. It'll help kind of frame the picture for identifying those top health priorities and how they aligned both between what our community feedback said as well as what was in the secondary data analysis. So looking at behavioral health, of course, we looked at the survey data and saw that 93% of our respondents said mental health was a significant health need. That's a 4 or a 5 on the survey, with 84% saying substance use was a significant health need. You'll see throughout this assessment, we highlighted the areas that the North Country region fares worse than the state in red. So that will help us see, where are we doing worse, as well as where are our identified areas from our community survey. So when we look at suicide mortality rate, the North Country region has a higher mortality rate compared to the state. Our suicide or self-harm related ED visits are also higher than the state. And then interestingly here, we see our opioid overdose deaths are higher than the state, 4.1 per 100,000, where our overdose ED visits are actually lower than the state, under 100 per 100,000. We also asked our survey respondents to share what additional services they might like to see in the area. So you can see the breakdown here with a big call out to both mental health as a top need, 52% saying they would like to see additional mental health care services available in the area, and then 27% said additional substance abuse treatment services are needed. Falls a bit in line too as we look at access to additional primary care availability and walk-in or extended hours as an access point to some behavioral health needs in the primary care space. So. Next, looking at prevention measures and health behaviors, you'll see here we're outlining at the county level, because that's how we had access to data. So we can compare COAS to Grafton and then New Hampshire. And we can see across the board, in COAS County, in the most northern region, we are faring worse than both Grafton and New Hampshire across some of these measures. So our physical inactivity rate, 24% in COAS County compared to 19% in Grafton. 43% flu vaccination rate and 48% in Grafton, so lower than the state averages. Our adult smoking rate is higher in COAS County, about 19%. And then when we look at our mammography screening rate across the counties, lower than the state average, 43% in COAS County and then 47% in Grafton. The chart on the right depicts annual wellness visits. So you can see here outlined in blue, we have COAS County. The dark green is Grafton. The light green is going to be New Hampshire, and then the US is in orange. So we can see that COAS County has a similar annual wellness visit rate as New Hampshire, and Grafton is closer to the US, both higher than COAS and New Hampshire. We can see a bit more increase over previous years, both in New Hampshire and the US compared to our regional counties, but some increase between 2022 and 2023 as we think about our Medicare annual wellness visits in the region. Next, looking at chronic diseases and some health outcomes. Our mortality rates, you can see across the region, faring worse than New Hampshire on average for coronary heart disease, cancer, stroke, and heart attack. And then looking at diabetes outcomes as well, we look at diabetes-related inpatient stays, pretty similar in the North Country region compared to New Hampshire. Our prediabetes prevalence is lower than the state, where you can see our diabetes prevalence is actually significantly higher. So interesting to see here our prediabetes being lower with diabetes higher, indicating potential lack of screening or delayed in terms of access to services or resources when we think about diabetes care. On the right graph, you can see our cancer incidence rates. When we look kind of at health equity through gender, we can see that male cancer incidence rates are in the light green, and then female are in the dark green. So across the board, both counties, New Hampshire and the US, we can see that men have a higher incidence rate of cancer, and this is across all cancer sites, than women, which is typical. Again, we're looking at the state and US rates. Because men typically, as we think about some of their health behaviors, whether that be, higher rates of smoking or physical inactivity, but also the utilization of healthcare services or delaying care. So as we think about some specific, maybe target populations, screening and prevention measures, how can we look at some specific areas or target populations through breaking down some of these disparities? Now, access and affordability. On the upper left side, you can see a couple maps. These are health professional shortage areas. These are defined through different categories. You'll see the blue is a health professional shortage area population. That means certain populations in those areas have a shortage of access to providers, whether they be low-income groups or rural communities who have limited access. The dark green is going to be a geographic health professional shortage area, meaning that that whole area is considered a shortage. And then the light green is considered a high needs geographic health professional shortage area, meaning there's significant shortage of providers in these areas, specifically for populations, whether that be based on income or rurality, et cetera. So for primary care, we can see that the whole North Country region is considered a health professional shortage area population for primary care providers. And then in mental health, we can see the whole North Country region being a high need geographic health professional shortage area. It's interestingly enough, though, for mental health, there's no other designated health professional shortage areas across the state for mental health. So it's really concentrated up in the northern region as we think about access to mental health providers. A couple other data points we're looking at here. Our median household income, again, we touched on lower than the state of 52,000 compared to 83. Our uninsured population is slightly higher than the state at 4.3%. And then no vehicle for the household. So think about transportation as a barrier. Just shy of 8% of North Country region residents do not have a vehicle for their household, which is higher than the state at 4.7%. So as we think about challenges in accessing appointments, but also accessing other opportunities, whether that be employment, healthy food, recreation, et cetera, a limiting factor. We also asked survey respondents what their top barriers to accessing healthcare were. We can see 46%. So the highest answer was that they did not have barriers to accessing care, but when we look specifically at some of these barriers, we can see cost and high cost of care and no insurance or high deductible ranking fairly high, which we see as pretty similar when we think about cost of healthcare, whether that be actual healthcare prices in the region are higher, or there's a perception of high prices, or if it comes down to insurance, co-pays, premiums, deductibles, et cetera, that are making prices high. Ultimately, when it comes down to it, people are paying bills for their healthcare services. So as we think about some of the objectives and priorities, how do we provide some education there, but also access to affordable healthcare services, or reducing some of those other barriers to care. And lastly, looking at social determinants. So we know that 80% of a person's health can be determined by non-clinical factors. So these are things in people's environment and daily lives that impact either their ability to have healthy behaviors, live in a healthy environment, access healthcare, et cetera. We asked survey respondents what are the key social determinants that are negatively impacting the health of their community. And we had housing instability or inadequate housing as the top social determinant, 65% of respondents saying that was a key factor, followed by poverty, lack of transportation, limited access to healthcare services, and lack of affordable childcare. So all over 50% of our respondents ranking these as significant needs. So as we think about, being healthcare organizations or healthcare service providers, some of these items might seem outside of scope, but important to kind of understand or assess as we think about our community and their health when we do a CHNA and look at that more macro level, but also as we think about how people are accessing healthcare, our no-show rates, our ED utilization, et cetera, and how some of these might be impacting them. Additionally, we can think about our healthcare workforce when it comes to childcare, transportation, and housing as well. Some of these secondary data points we're looking at, families in poverty in the North Country region, 23.5% compared to 13.3% in New Hampshire. We have a lower percentage of population with a bachelor's degree or higher at 25%. Our households who receive food stamps or SNAP benefits at 11.4%, higher than the New Hampshire average. Also looking at homes built before 1970, over 30% of homes in the North Country region. So aligning with that potentially inadequate housing. And then substandard housing, a little lower, fairly similar to the state average. So as we think about things like running water, electricity, safe housing, etc., that is going to indicate that. So as we go through this data and the assessment we did, you can see how we kind of overlapped that community feedback with the secondary data analysis to really identify not only what some of the top health challenges are, but who are the populations in our community who might need extra help or support in accessing health services or living healthy lives, which helps inform our significant health priorities. So of course, there is many health priorities in the community, especially as we think about a healthcare system and what we are doing to, treat patients and improve health. But through this assessment, the goal for all the organizations, especially working together, both North Country Healthcare and Coos County Family Health, to identify what are some of the top priorities that we can, address through this assessment and what do we really want to focus on. So the organizations, we outlined 3 different top priorities from the assessment. Probably not surprising since you've sat through this presentation and seen, the data and the feedback, but the first goal being to improve behavioral health outcomes. Again, we heard feedback on the prioritization of mental health and drug and substance use, as well as our high suicide mortality rates and opioid overdoses. The second goal, to increase access to local healthcare services. So again, across the board, heard feedback on access to local services, convenient locations, transportation, and items like that, which also can overlap with our barriers to care. A big part of this being that affordability piece, but not just affordability of healthcare services, but those items like transportation, healthy food, making sure our patients are connected to community resources to live healthy lives, whether they're patients or outside of the organization. So to wrap up our presentation, we'll go through some of the key objectives for these goals that were outlined. In the full Community Health Needs Assessment report, the implementation plan includes a list of resources, both between North Country Healthcare and Coos County Family Health, to identify what are we currently doing to address these needs and what are some future objectives or focus areas that we can work on over these next 3 years. Obviously, with the ultimate goal 3 years from now, we can do this assessment again and see some gradual improvement or increase in access or coordination of some of these services. So I won't read through kind of all the range of different services offered between these 2 organizations, but I will say this isn't the extensive list. It is included in the full report, but there are a range of services to address these health needs like behavioral health, whether that be emergency services, recovery support, medication disposal, access to care, and social workers between both of these organizations, specifically targeting the populations. But the key here is the objectives and the conversations that were had in terms of what needs to be focused on in the future. So the 3 objectives identified from this assessment are to identify and pursue new grant opportunities, including telehealth-specific opportunities, to expand and sustain behavioral health programs. So key factor here, especially as we think about telehealth and some of the barriers, whether that be transportation or we know that there's limited access to providers in the North Country region. Second objective, to develop a long-term sustainability plan for the current grant-funded initiatives with a focus on workforce development. This is greatly important, especially as we think about some of the programs we have and making sure that we can continue them into the future. And then lastly, advance integrated behavioral health models by strengthening community partnerships and building seamless connections between behavioral health and community resources. So throughout this assessment, the key theme here is really strengthening those community partnerships, and what we always suggest and bring up, especially when it comes to behavioral health, is the need for that collaboration and community partnership between organizations, whether it's North Country Healthcare and Co-op County Family Health and other community and social services as well, whatever they can tap into, because we know there are limited resources, both when it comes to funding as well as just the workforce in the area. So how can we create some of that collaboration or synergies between the organizations to best serve the community? Our next priority, to increase access to local healthcare services. Again, range of different services provided both through North Country Healthcare and Co-op County Family Health, whether that be specialty care, primary care, convenient care options, dental care, education, etc., that is currently provided, but with a future focus on the 3 objectives at the bottom: to strengthen the healthcare workforce by prioritizing recruitment and retention strategies for key services to ensure adequate access to care across the region. Of course, huge priority there when it comes to maintaining the healthcare workforce as a challenge for everyone. Next, to continuously evaluate healthcare infrastructure through facility and capital planning to support expanded service and program delivery. And lastly, increase community awareness of available local healthcare services through coordinated outreach, education, and marketing efforts. So a lot of conversation during this process around this last piece, especially when it comes to awareness, not just for patients in the community, but how do we make sure that the stakeholders within the healthcare systems or social services are also aware of the range of services that can be provided, and we can adequately make sure our community members are accessing those services as well. And a lot of conversation too around, if these services are accessible, how do we make sure we're reducing stigma that allows people to appropriately access the services that they need. And our last priority, reducing barriers to care. Again, a little broad and encompassing a few factors, whether that be financial assistance and support or some social needs like screening for social determinants of health, partnering with transit, or providing food security. The key objectives here are to develop a sustainable and standardized model for implementing social determinants of health screening, with a focus on ensuring patients with a positive screen are connected to resources. So the first step, we would say, especially when it comes to population health, is gathering the data. So if we can do that, great. The next step is really making sure we're utilizing the data to improve the outcomes for patients. So how do we make sure when patients are screened that they are connected to resources and then followed up on appropriately? Next, explore creating a centralized resource list of organizational and community services and resources to be utilized by patients and providers. So an interesting finding from our assessment was from our survey, where majority of respondents, over 80%, say they get the majority of their health information from their provider. So how do we make sure we equip providers in the community with adequate information on what services are provided, how to connect them with kind of that next step of care, whether that be within the healthcare organization or outside of it. And then lastly, continuously evaluate financial assistance programs to ensure they are responsive to emerging financial barriers. So of course, a continuous challenge as we think about more at the macro scale of the economy and challenges that people are providing, but how do we make sure that when people need care that they can access it financially? So with that being said, that is the findings of our community health needs assessment. We're happy to take any questions, as well as if anyone on the NCH team has input on some services, programs, or future opportunities or questions we want to discuss with the remainder of our session.